My previous dentist had passed away, and my health was kind of spiraling downhill, actually spiraling pretty rapidly. I knew I needed to get some kind of help somewhere, and so I started searching for somebody who could fix this whole failed fiasco in my mouth. I have to put everything in a blender. I live off of smoothies. Going out to eat is horrible and embarrassing because I'm very limited. I have to eat soup or something mushy that I don't have to chew and can just swallow. It's become very humiliating.
June walked into my office about 5.5 years ago, and she had a bunch of implants placed somewhere else and what supposedly was a implant-mounted denture. When she opened her mouth and I took a look at it, it was literally the worst case I have seen of implant placement and denture fabrication. She couldn't chew, she couldn't eat, and everything that was done completely wrong. And she had paid a lot of money to have it done.
When I met Dr. Weber, he gave me hope. He just said, we can do this. We can give you your bright smile back. I'm going to be able to smile, and I can eat. Can't wait to grab that apple.
I told her that I could fix it. And her first thing she said to me was, well, if you take the implants out, I don't have enough bone. Well, that's something I hear just about every day. I don't have enough bone for implants. And that has gone away. That was many years ago when implants first came out. But nowadays, there's nobody who can't have implants and not have dentures. Dentures are a thing of the past. If you have dentures, you don't need to have them. You choose to have them. June wanted help with hers, and I presented a treatment plan and told her that she had bone in places that we could use and that we didn't need to put 7 or 8 implants in like she had. Not only did she have 7 implants, but they were 7 different types of implants and none of them worked together. Only 2 of them were being used to hold in what she was calling her denture, which really wasn't a denture at all. It was just acrylic with some teeth stuck in it. And I said that we could do it with 4 implants, and she just didn't see how that was possible. So I presented it to her how we do it nowadays, and that we have thousands and thousands of cases around the world that we've done that are successful and work out. Then came the financial part, and June went out to try and work on that so that I could help her. And that was where we kind of hit a stumbling block for her. And through the years as she was working on it, I started getting letters. Letter after letter after letter of people asking me to help you. Telling me what you do for them, what you do for other people, how much time you give to the people around you, and that you never put yourself first, and that your quality of life has been diminished because you obviously can't chew or eat with what is mounted in your mouth. I thought to myself, in my career, if there's one person that I've seen that needed my help more than anybody, it was June. So I called the implant manufacturer and convinced them to donate all of the hardware and parts that make up most of the cost of what we do, and donate their supplies and everything I needed. Then I called the laboratory who manufactures the prosthesis, the denture, Robertson Dental Lab, and the lab donated their services for the case.
So what we have here is a picture of June's face, and this stuff is really exciting because this is from our CBCT scan data, and the image can actually be taken of her skin. And Daniel, if you can switch to the next picture, what we show in here now is actually what's inside of June's skin. This is the skull, this is the bone, and we can take this image here and we can send it to the printer and we can print an actual replica of what she has under her skin. That stuff is amazing.
The print will come out like this. When we're able to do a practice surgery, once the surgeon decides what kind of implants he wants to place, he'll go ahead and put them in. This case will have zygomatic implants. They'll go here into this bone on each side, and then go through the roof of the mouth.
And that's what's really neat about this technology. And it's so precise, it's accurate to within microns of recreating this patient's skull. In this particular case, the patient, just like June's mouth, doesn't have any teeth on the upper. And what you're looking at is the bone that's left after the teeth are extracted. And with that technology, we can do a much, much better job. And in June's case, it's going to be a huge benefit because she is such a unique and maybe difficult case to do. What we do for Dr. Weber is make most of his restorations out of this material right here. It's called zirconia. It's an extremely hard porcelain-like product, and we can actually make the entire restoration out of it. It's a solid material, and it's very, very strong and very durable. It really doesn't wear in these restorations. So here we have a zirconia restoration. We've made this from a wax-up that we've milled the zirconia from. We scanned the wax-up, milled the zirconia, and now it's a beautiful set of teeth for June. The teeth are then glazed, and the pink porcelain is added to the surface here. We have the pink porcelain across the top, and then to match the gums, and then in that we've cemented titanium cylinders. And this restoration will sit right onto those implants, and it'll mate right up with her gums. So you can see it'll mate. This is an upper that June's going to have done, and it mates right up to the gums right here like that. And then of course she'll have a beautiful smile.
In her particular case, it was so bad, it was going to take 2 doctors chairside to make this case successful. And Dr. Mark Bienstock of Santa Barbara Oral Surgery agreed to donate his services with me and his knowledge and his expertise.
These actually look pretty incredible for temporaries, and this is very similar to what you'll walk out with the day of the surgery. You'll wear these for a number of months until it's time to move to our next step, and then Dr. Weber will then build you your final set of teeth, which he has an example of.
Once you told me that you'd love your test drive for 6 months, the teeth you walk out of surgery with, I will be building you a final set, which will look like this. It'll feel like that. It'll be made out of the same material, and that will be screwed in, and the only way that it can be removed is by me removing it. We were able to remove her old 7 implants, place 4 new implants, put her teeth in the same day, and when she woke up, she had a brand new set, a full set of teeth. Everybody donated their services for this case, and it's one I'll never forget. I just felt it was the ethical thing to do after what she paid for and the pain and suffering she went through and the embarrassment. I didn't need to be paid for this. I just felt that it was the right thing to do. Today, I've just put your finals in, and this is what you get to wear for the rest of your life. Here is your new smile.
Oh my gosh, look how beautiful. I'm not afraid to smile anymore.
So June, 5 years ago, this is the lady I met in my office, and I took a picture of you right away. And I said, that was the smile you walked in with. This was the supposed implant denture that you had, with the failing implants underneath and the denture that was completely non-functional over the top of that. These were the x-ray that I took, and there's where the implants were and how non-functional they were. We took those out in one day. We placed 4 implants, new implants in, and we replaced your teeth. The next day after surgery, 12 hours later, this was the smile that we had, and this was the teeth that you walked out of the office with. And here we are today. We just put in your finals that you'll be leaving with, and your case is completely done, your smile has been restored. What do you have to say with somebody who has dentures?
Oh, get rid of them. Get rid of them. Do the implants. It's worth it. Well worth it. My health has improved. My self-esteem, I mean, everything has improved. I can smile, I can eat, I can laugh.
I really appreciate my entire team. Dr. Mark Bienstock, Robertson Dental Lab, my team here, my staff, my partner, David Becker, all worked for the last 6 months to make this happen at no cost for her.
My life changed the minute I walked into Santa Barbara Dental. I had non-functional mouthful of implants. Then when I met Dr. Weber, he just said, we can give you your bright smile back. And look at me, he did. You've just given me such a wonderful gift, and you've given me my life back. Thank you.
You're welcome. You're welcome.
Santa Barbara Dental Care, your dental implant experts.